Hi, my name is Ansel Tung, and I'm about to do my presentation on my community health organization. My community health organization is the ALS Association. The vision and mission of the ALS Association include to create a world without ALS, the mission, leading the fight to treat and cure ALS through global research and nationwide advocacy, while also empowering people with Lou Gehrig's disease and their families to live fuller lives by providing them with compassionate care and support. A description of the organization. The ALS Association was established in 1985. It is the only national nonprofit organization fighting Lou Gehrig's disease. It funds almost 100 active research projects globally and leads way in research, care services, public education, and public policy. There are nationwide networks of chapters and searches for new treatments and a cure. Works and contribution to community health. The ALS Association coordinates multidisciplinary care through certified clinical care centers. They foster government partnerships, build hope and enhance quality of life for patients, and provide support to patients and their families. The ALS Association has many locations. There are 40 chapters nationally. The main chapter or headquarters is located in Washington, D.C. The local chapter is located in Raleigh, North Carolina. The ALS Association offers a variety of jobs, one including the Director of Digital Strategy and Operations in Washington, D.C. This job description includes reporting to the Senior Director of Digital Strategy and Operations. The successful incumbent will ensure that the association's online presence incorporates best practices in support of delivering the organization's mission across a wide range of digital properties. This position primarily serves as a technical expert responsible for implementation and support of the association's web projects. Volunteer opportunities include computer data entry or word processing, fundraising or special events, media relations, administrative and clerical work, staffing health fairs, photography, speakers bureau, and grant writing. The organizational chart for the Jim Catfish Hunter chapter of the ALS Association goes as follows. The president, Jerry Dawson, has a director of care services who has two managers and a care services coordinator under her. Also under Jerry are a program manager, a director of development, data and special projects coordinator, manager of events, a team development specialist, finance manager, and under the team development specialist, there is a developmental administrator. In the 2014 financial statement, it gives the different funding sources for the ALS Association as of 2014. In 2014, the ALS received funding through contributions that equal 29% of their funding, bequests, which equal 23% of their funding, chapters, 26% of their funding, in-kind contributions, 18% of their funding, other income, 4% of their funding. The ALS promotes and markets their organization through Walk to Defeat ALS, the ALS Ice Bucket Challenge, and their memorable ALS Association logo. Walk to Defeat the ALS is probably one of the most recognizable walks. The Ice Bucket Challenge is a challenge that was invented in 2014 to promote advocacy and awareness of ALS. The ALS Association has collaborations and partnerships with a variety of different organizations. These different organizations contribute from $1,000 to over $500,000 to the ALS Association. Lisa Hoskins, the care services provider at the ALS Association Jim Catfish Hunter chapter, let me know that they evaluated their program through an annual patient survey to gauge the effectiveness of their programs. On October 7, 2015, I had a phone interview with Christine Duquet, developmental administrator at the ALS Association Jim Catfish Hunter chapter in Raleigh, North Carolina. She taught me that in order to really enjoy the experience of working at a nonprofit, I would have to have a strong passion for what the organization's mission is. Ms. Duquet gave me reassurance that I chose to be in the right major because of her passion in the field. She made me believe that I will find an organization in my health interest that I can really rally behind, advocate for, and put my passion towards. If I were to do a project plan for the ALS Association, I would not need a mission nor vision because they already have those. However, I would need finances to fund the project. I would need a budget so I know how and on what these finances are being spent on. I would need to market my project to the target population, and also I would need to engage the stakeholders of that community. These are my references, and thank you for watching my presentation.